the behalf of Dr. Singh Kaura. Sir is unable to come due to some unknown reasons. Now, coming to the numbers, approximate 1.5 lakh the annual deaths are there from road traffic accidents per year in India. They can be the potential organ donors in the India, but unfortunately we have less than one donor per million population. Organ donation rates are there, and the Spain's rates are highest in the world with the 48 per million organ donors per population. And fortunately we have improved our statistics from 2012 from four times higher than the initial rates, which was 0.16 per million population to 0.64 in 2023. The legal framework evaluation, this act was originally initiated in 1994, started as a Transplant of Human Organs Act, which enacted in 1994 to regulate organ removal, storage, transplantation while preventing commercial dealings. It was adopted by all states except Jammu and Kashmir and Andhra Pradesh, which maintained their separate state legalization for same. But the major amendment which came in 2011 and become effective in 2014 renamed it as THOTA, the Transplantation of Human Organs and Tissue Acts. It's expanded the scope to include the tissues apart from the organs, and it included the expanded donor definition, and it enhanced the penalties for the illegal organ trading. The key amendments under the 2011 scope was expanded scope. It includes the tissues along with the organs, and the definition of near relative was expanded to include the grandchildren and grandparents also. And the new provisions and operational improvements were there, like if there is no facility of if the hospital is not having facilities to start a transplant surgery, they can still register for being a retrieval center. And swab donation was also approved, and there was a provision of transplant coordinator in all the registered hospital. It was mandated. And under this act, national network was established, and there was a national registry for all the transplant recipients and donors. And enhanced protection provisions were there, higher penalties for organ trading, simplified brain death certifications, and greater cautions for minors and foreign nationals were included. Key provisions of the acts are infrastructure, equipment requirement and guidelines and SOPs was defined, qualification of the transplant surgeon and tissue retrieval technicians were defined, appointment of transplant coordination with defined qualification is mandatory now in the all transplant centers. NGOs, trust and the societies working for the organ and tissue removal now have to register with the National Organization for Transplant Act. Another new provision of the act is it identifies the brain as a death or form of death. It outlines the process and criteria for brain death certification. It also allows the transplantation of human organs and tissue from the living donors and the cadavers after cardiac and brain death. Living donors can be defined as the near relative living donors, spouse, children, grandchildren, siblings, parents and grandparents needs the permission of doctor in charge of the transplant centers to donate his organs. And a non-related donors needs the permission of authorization committee established by the state of the organ, donate his organ. Now the next thing is swab transplantation. When a near relative living donor is medically incompatible with the recipient, the pair is permitted to do a swab transplant with another unrelated matched or donor and recipient pair. Now comes the authority, appropriate authority, which is in most cases a regional or organ transplant approval committee, inspects the grants registration to the hospital for transplantation, enforces the required standards for hospital, conducts regular inspection to examine the quality of transplantation. It may investigate the complaints regarding breach of provision of the act, and has the power of a civil court to summon any person, request documents, issue search warrants. An advisory committee is consisting of experts in the domain who shall advise the appropriate authority. Next is authorization committee, which is usually an institutional committee which regulates the living donor transplant by reviewing each case to ensure that the donor or the family of donor is not exploited for monetary consideration and to prevent the commercial dealing in the transplantation. This proceeding has to be video recorded and the decision should be notified within 24 hours. Appeal against any decisions of the committee may be made to the state or central government at any point of time. Next is the medical board. The panel of doctors responsible for brain death certification in case of a non-availability of a neurologist or neurosurgeon, now any surgeon, physician, anesthetist or intensivist nominated by the medical administration in charge, which is usually medical superintendent of hospital, may certify the brain death. And authorization of organ donation after brain death, if a person wants to donate his organs after the brain death, that he himself or herself can give his consent before in his living state, or this consent can be obtained by the person in the legal possession of the body, and the doctor shall ask the patient or relative of every person admitted in ICU whether any prior authorization has been made. If not so, patient or his relatives should be made aware of the option to authorize such a donation. And sources of the donors, sources of the transplant are, number one is living donor, which most of the donations in India is happening by living donor only. There are three categories: near relative donors, non-relative donors. Near relatives includes mother, father, son, daughter, grandparents, or brother or sister, suppose. Non-related donors must demonstrate affection, attachment, or special reason without authorization, with authorization committee approval, and swab donors. And next is deceased donor transplant, which can be a brainstem death donor, which is most practical or option. Victim of accidents where brainstem is dead, organ remain functional through life support systems. Cardiac death donors are limited to certain tissue in current scenario like blood vessels, cardiac walls, skin, or cornea. The living donation is actually a immediate solution, but the deceased donor have a greater potential for meeting organ needs without receiving living donors. What are the critical challenges in organ transplantation in India? There is massive supply demand crisis, huge burden of organ failure cases versus the poor availability of donors, infrastructure gaps, especially in the government sectors, transplantation challenges, especially in the interstate organ transportations, awareness barriers are there, lack of understanding of public about the brainstem death concept, also the poor certification practices by the hospitals. Systemic issues, organ trading concerns, state reluctance to adopt the amendments, and gaps in data reporting and owner registry entry. Economic barriers are there, high cost, especially the uninsured and for the poor population, and maintenance of transplant standards. This is a complex web of issue. It requires coordinated solution across legal, medical, and social dimensions. And the Government of India has launched the National Organ Transplant Program in 2021 to systematically address the organ shortage through comprehensive institutional mechanisms. According to this program, there are 3-tier institutional network has been set up. The apex body, which is in Safdarjung Hospital, New Delhi, is called as NATO, National Organ and Tissues Transplant Organization. And the regional bodies, there are 5 regional bodies covering multiple states, and there are 22 SOTOs have been sanctioned, state level organization for local coordination. This network creates from national policy making down to state level implementation, ensuring coordinated organ donation and transplantation services across India. These 5 regional organizations are Western region Mumbai, Southern region Chennai, Eastern Kolkata, Chandigarh Northern region, and Guwahati Northeastern region. And each was receiving 81 lakhs annual grant, which is increased to 1.6 crores in 2014 amendment. And there have been 22 state organizations have been sanctioned, and the comprehensive functions of this network is a regional coordination training program, institutional activities, technical guidance, and biomaterial center establishment across all the networks. This program addresses the huge bridge and supply gap, improve access, efficient procurement of the tissue retrieval from the deceased donor and distribution, and also addresses the infrastructure developments for the new facility and strengthen the existing facilities and transplant centers. And also there is a provision of training of the manpower and monitor services for the continuous improvements. These are the various forms available on the Noto website for different purposes, including consent from the near relative, suppose, other than near relative, consent for the psychiatric evaluation, HNA DLA profiling. Everything is now digitalized and all can be accessed on the website, and these all consents are also available in the regional languages on the respective state organizations' websites. This is a prototype form which any hospital, if wants to register as a retrieval center, they can apply, duly signed by the head of the institution. This is the basic prototypical form. And Noto have enhanced the digital infrastructure, national registry and policy development. The functions of Noto are policy guidelines and protocols development, web-based networking, national registry maintenance, advocacy, awareness and training coordination, research and information dissemination, and national biometal center operations. The key achievements till date are dedicated website for transplant, 24/7 helpline number, and national registry has been maintained digitally with number of pledged donors and waiting list, and organ allocation policies have been approved, SOPs have been drafted, which all data is available through the website. These are the 5 regional organizations. Western Roto is situated in the Sachdeva Medical College, Mumbai, covering Maharashtra, Gujarat, Goa, UT, Dadar Nagar Haveli, Daman, Diu, MP and Chhattisgarh. Southern Roto is Government Multi-Speciality Hospital, Chennai, covering Tamil Nadu, Kerala, Telangana, Andhra, Karnataka, Puducherry, and Andaman Nicobar Islands and Lakshadweep. In eastern side, IPGMR Kolkata is the regional center, covering West Bengal, Jharkhand, Sikkim, Bihar and Orissa. In the northern side, PGI Chandigarh is the regional center, covering Punjab, Haryana, Himachal Pradesh, J&K, Chandigarh, Rajasthan, UP and Uttarakhand. And northeastern side, Guwahati Medical College, covering Assam, Meghalaya, Arunachal Pradesh, Manipur and Nagaland. These are the state organizations which have been sanctioned and funded by the national organization. Total 22 have been sanctioned so far. The status report, a living in 2023, the living donor after the age of 18 years or above can donate either one kidney or a part of liver only, but one brainstem donor can donate up to 8 organs, namely heart, 2 lungs, liver, 2 kidneys, pancreas, small intestine, and many tissues like cornea, bone, skin and heart valves. A donor after natural cardiac death can donate only tissues like cornea, bone, skin and blood vessels. These are the organ donation trends in the Noto's annual status report 24. The number of transplants, total transplant in India have rise from 4,990 to 18,378 over the past 10 years up to 23, with a dip in 2020 and 2021 due to COVID pandemic. And total living transplants rise from 4,153 to 15,435 over the past 10 years. Number of deceased donors, which was 340 in 2023, rise from 340 to approximately 1100 in 2023. Total deceased transplant which happened out of these deceased donors was 837 in 2013 to approximate 3000 in 2023. Number of deceased donor, total deceased transplant is in 2023, number of total deceased donors was 1099, and total transplant made out of these donors was approximate 3000, which was average transplant per deceased donors was 2.67. This is the transplant status report from the different organs, and total transplant done was 18,378 in 2023, and out of which 1600 was deceased kidney transplant and 11,000 was live kidney transplant, and 840 was deceased liver transplant, and 3600 were live liver transplant, and with 8 Domino's liver transplant. We are very far behind in cases of heart, lungs and pancreas transplant from the global average. In the gender distribution of living organ transplant in 23, the majority of donors were female, and one transgender was there as a donor. In deceased donor transplant, majority are males, comprising 77% out of total transplant made in 2023. Coming to the organ-wise data, kidney transplant happened in 2023, total 13,426, out of which majority were living transplant. And number of kidney transplants happened in 2023. The Delhi NCR was the highest number of living kidney transplants, and with our state Punjab scored on the 10th, comprising 602 transplants happened in the 2023. Liver transplant, total 4,400 were done in Pan India, out of which majority were living transplants. Pancreas, there are very few cases done in our country, with Maharashtra doing maximum transplant. Lung, Telangana outscored every other state in 2023 with maximum number of transplant. And heart transplant, also Tamil Nadu outnumbered every other state with total number of 70 transplant in India. Coming to the state-wise score, Delhi NCR top scored in 2023 in living donor transplant. Number of deceased transplants were highest in Tamil Nadu. And future vision of this policy, the government of India is committed about the one nation, one policy. The reforms have been made and sent for the implementation to the state. Condition of state domicile for registration of recipient to receive deceased donor organ for transplant has been removed in this new amendment. Upper age limit for the registration of recipient for receiving deceased donor has been removed. Now a person of any age can register for receiving deceased honored organ, and no fees has to be charged by the hospital for registration of the patient receiving deceased donor organ. And uniform organ transport policy has been laid down by the government. 7 ministries coordinated by the Niti Aayog, Ministry of Civil Aviation, Housing and Urban Affairs, Railways, Transports and Port and Shipping, Waterways, Home Affairs and Defence. Each concerned ministry will have a nodal officer, and the state organ transplant organization will coordinate with that nodal officer to facilitate the transplant program. And there will be no screening of, under this act in amendments, there will be no screening of organ done at the airport, and metro rules have been revised to allow the transplant of human organs in May 2023. These are the financial grants which is given to the regional societies or state societies by the national organization. Approximate 1.6 crore for the regional societies annually, approximate 80 lakhs for the state societies annually, and for setting up the retrieval center, 75 lakh grant have been sanctioned annually for retrieval center, and for transplant center 1.5 crore annually, and so on. And financial support, current financial support being given to the patient is 10,000 per month for BPL transplant recipient, 4 immunosuppressant drugs, 1 lakh per deceased donor maintenance, 50 to 100 lakh for new or upgraded transplant center and transplant coordinator hiring support, and 1 crore for the biometric centers. Awareness initiative, we must focus on poster competition, walkathons, media campaigns, corporate outreach, schools and educational institutional outreach. And everybody can pledge for organ donation on the website. There is a single website available nowadays, noto.gov.in. Till now, this is the yesterday's data, 4,32,227 donors have pledged for their organs. Thank you.